guys know about hemophilia?
Well, I know that hemo has something to do with blood and the structure of a blood cell.
Yes, Amy?
I'm guessing it has to consist of blood clotting too.
Yeah, it has to do with blood clotting. Hemophilia is a genetic disease in which a person lacks or is deficient in proteins called clotting factors. This prevents blood from clotting properly. So everyone has 13 clotting factors. So like if you have an injury site, your blood rushes to that site, and like there's proteins that go there, like platelet plugs and stuff like that, and it helps to heal the cut. So it usually occurs in males rather than in females, since it is directly from the X chromosome. A low level or absence of any of these factors causes bleeding to continue. So hemophilia is when like a person has when someone gets a cut, they continue bleeding for a long time and it doesn't really stop, because hemophilia is like a shortage on those proteins that like help to plug up the walls when you do get a cut. It's caused by a defect in the gene that determines how the body makes factors 8, 9, or 11. So these genes are located on the X chromosome, making hemophilia an X-linked recessive disease. It mostly occurs in males, but it can occur in females as well. And when it occurs in males, the boy gets it from his mother because he gets the Y chromosome from his dad. So guys have X and Y chromosomes, and girls have XX chromosomes. The mother passes down the affected X chromosome, and that's how someone would have it. So it's passed from mother to son on the X chromosome. For a girl to get hemophilia, she would have to receive affected X chromosomes from both of her parents. That's kind of unlikely, but if a girl were to get it, it's usually like the symptoms usually don't occur in her, so you guys wouldn't really notice it. But girls can be carriers of the disease, so like you can be a carrier of it and not know that you have it, and then when you have a child, if he's like a boy, if you guys decide to get him circumcised, that's like the first indication of hemophilia, because then the bleeding doesn't stop. And other indications would be like bruising, etc. You can also develop hemophilia after birth, and that's called acquired hemophilia. The immune system forms antibodies that attack factors 8 and 9. The types of hemophilia are hemophilia A, also known as classic hemophilia, and it's caused by a deficiency in factor D. It's the most common type, so 1 in 4,000 to 1 in 5,000 males worldwide are affected. This accounts for 80% of cases in hemophilia. Currently, there are 20,000 males living with hemophilia A, and half of them have the severe form of the type. This is 4 times as common as hemophilia B. It's also known as Christmas disease, and it's caused by a deficiency in factor 9, and it occurs in approximately 1 in 20,000 males born worldwide. Symptoms are unexplained and excessive bleeding from cuts and injuries after surgeries or dental work. Many larger deep bruises, so if you notice that you bruise easily or you have an excessive amount of bruises on your body, that could be a sign of hemophilia. Unusual bleeding after vaccinations, pain, swelling, or tightness in your joints, blood in your urine or stool, nosebleeds without a known cause, and in infants, unexplained irritability. Some complications of hemophilia may include deep internal bleeding, damage to joints, infections, and adverse reaction to clotting factor treatment. To be able to diagnose hemophilia, what I said earlier about having a baby boy, you notice that he continues bleeding after he gets circumcised. That's an indication of hemophilia. Or bleeding for a long time after drawing blood in the heel sticks when you have a baby and they draw blood in the heel. Unusual raised bruises or large amount of bruising. The median age at diagnosis for mild hemophilia is 36 months, moderate hemophilia is 8 months, and severe hemophilia is 1 month. These are just some tests that doctors do on patients to recognize if they have hemophilia or they don't. So the tests are coagulation factors test, fibrinogen fibrinogen test, PT, and INR test, PTT test. So the coagulation factor testing is performed to determine if a person has enough coagulation activity to control the blood clotting process. Fibrinogen test is used to evaluate how much fibrinogen you have in your system, and if it converts to fibrin when the blood is being clotted. If it doesn't convert, that's when you know something's up with your factors. The PT is used along with the partial thromboplasmin time, which is PTT. It's used to help diagnose the cause of unexplained bleeding by seeing the ratio there is between calculations based on the results of the PT, and is used to monitor individuals who are being treated with the blood thinning medication, which is anticoagulant. If it's hemophilia A, it's factor 8. So if you are producing 1% or less of that factor, it's considered severe. And for someone who's producing 2% to 5%, that's considered moderate. For someone producing 6 to 50%, that's considered mild. It's normal for people to produce 50 to 100% of the factors. Some treatments for hemophilia A are a prescription hormone called desmopressin, which can be given as an injection into your vein. This medication works by stimulating the factors responsible for the process of blood clotting. For the treatment with hemophilia B, you infuse your blood with donor clotting factors. Sometimes the factors may be given in the synthetic form. These are called recombinant clotting factors. And there's replacement therapy, so that's when you don't have enough of either factor 8 or factor 9. So you guys just, like doctors, just put the factors into your body. And some complications of this could be you could develop antibodies that attack the clotting factor. So since it's like an unknown factor being inserted into your body, you can develop antibodies which basically destroy those proteins that are being inserted into your body. You could develop viral infections from human clotting factors, or your joints and muscles and other parts of the body can be damaged from delays in treatment. Do you guys have any questions? Yes, Sarah?
You never said what PT stands for.
PT stands for prothrombin time, and that's when it's used along with the partial thromboplasmin time to help diagnose the cause of unexplained bleeding. The internationalized normal ratio, so that's the INR, is a calculation based off the results of PT, and is used to monitor individuals who are being treated with the blood thinning medication. This test used to determine the ratio of the factors I think you have in your blood. Jessica?
Are there any natural ways of therapy besides prescription medication?
No natural ways of therapy were listed because back then when there wasn't any treatment, when people were diagnosed, they would be like, okay, you're going to die in 11 years because they didn't have any way to treat that. So whenever they got hurt, they would lose a lot of blood. So now it's basically just medicine or replacing the clotting factors in your body. Yes, Amy?
Why did you choose to do this?
I'm just really interested in blood. I searched up blood diseases, and this was the most common ones. Yes, Sarah?
Can any of the types be failed today without medication?
Yeah, because if you don't take any medication, you'll probably die within a couple of years. Whenever you get injured or anything, the most severe symptom of hemophilia would be internal bleeding, and that's actually kind of common. So people would have to take these medicines or replace their clotting factors so it doesn't happen. Yes, Andre?
What happens when you bleed internally? Can you explain?
One of your tissues or organ has a cut and you start bleeding internally. Your clotting factors can't work together to form a plug. Some of the factors lack or they're deficient in the proteins, so your body can't form a plug there and it can't plug up the injury site. Yes, Sarah?
Do you know what happens if the body has less than 13 clotting factors?
Hemophilia A and B, even though it's like different factors, they're kind of the same in symptoms, although hemophilia A is more common. If someone were to just have like 12 clotting factors, it would probably result in the same thing, where your body can't heal itself as quickly because you don't have as much clotting factors to plug up an injury site. I'll just ask you guys the questions. Hemophilia is when the blood won't stop pouring out of your body. You genetically inherit a disorder stop working or your blood does not clot properly. The last one, yeah, that's correct. Who does hemophilia usually affect? Babies, old white men, old women, or males? Yeah. The most common type of hemophilia is hemophilia A, hemophilia B, C, or D. Yeah. A lacks which factor and B lacks which factor?
C.
Yeah, it's C. So A lacks factor 8 and B lacks factor 9. Can a person develop hemophilia after birth?
Yes, isn't that required?
So, yes? What is it called?
Acquired hemophilia?
Yeah, so a person can develop hemophilia after birth, and it is called acquired hemophilia, and that's when their immune system develops antibodies, which tries to destroy their factors, their clotting factors. Where does a baby boy inherit hemophilia from? Yeah, so a baby boy inherits hemophilia from his mother through the X chromosome. Can a girl have hemophilia? If so, how?
Yes.
So yeah, a girl can have hemophilia if she inherits both affected X chromosomes. So hemophilia is ... inherited from the father, untreatable, and X-linked recessive disease or uncommon. Yeah, so it's an X-linked recessive disease. Does hemophilia have a cure?
No.
No?
No.
Yes? Yes or no?
Yes.
No, so there's no cure, but there are treatments, and that just helps to replace the clotting factors in your body. How does a person have acquired hemophilia? Like, what causes a person to have acquired hemophilia?
They're born with extra antibodies that attack the clotting factors.
So yeah, their immune system forms antibodies that attack clotting factors 8 and 9, and their body's immune system tries to destroy its own factors. What tests can be used to diagnose hemophilia?
Nitrogen test.
Coagulation.
Yeah. So
Circumcision.
coagulation test, PTT test, PT test, and the fibrinogen test. Hemophilia is considered severe when so a person produces less than 1% of the affected factor. So either factor 8 or factor 9. Hemophilia is considered mild when 6. So a person produces 6 to 50% of the affected factor. Hemophilia B is also known as yeah. Hemophilia is a type of ... heart disease, respiratory disease, blood disease, or lymphatic disease. True or false? Hemophilia is passed on through germs on surfaces.
False.
The most common sign of hemophilia is